Hello, everyone. Welcome to the Masters of Science in Nursing, MSN, and Postmaster's Certificate Program webinar. And thank you so much for taking the time out of your day to participate. So my name is Jane, and I will be your moderator for today. And before we begin, I have a few logistics that I want to cover. First, you are in listen-only mode, so the presentation is being broadcast through your speakers to avoid any background noise. Second, please feel free to ask questions as we go. You can do so by typing into the Q&A box at the left side of your screen at any time throughout the session. If we do not get to your question today, an enrollment advisor will follow up with you. Third, you can watch this presentation on demand at any time using the link you used to register. We will also follow up with an email after the presentation. Here is what we will be covering. On today's agenda, we will introduce the presenters, then talk a little bit about Maryville, who we are, the program information. We'll get some faculty perspective, and then we'll conclude with the live Q&A session. So let's meet our presenters. Today we have 3 different presenters for you. We have Professor Nina Zimmerman. She is the Assistant Professor of Nursing and the Director of the MSN Nurse Practitioner Program. Dr. Zimmerman, or Professor Zimmerman, did you want to say hello?
Sure. Hello, everyone. Thanks for attending the webinar tonight. And we appreciate your interest in Maryville, and we hope that we can provide some useful information and answer your questions.
Awesome. Thank you so much, Professor Zimmerman. We also have Dr. Mikhail Elby on the phone, on the line. She is the Assistant Professor of Nursing and also the Program Coordinator for the FNP program. Dr. Elby, did you want to also say something really quickly?
Yeah, thank you everyone for spending some time with us to learn about our program, and I hope this is very informative for you all.
Thank you so much for being here, Dr. Elby. And last but not least, we have my colleague, Alex Buell. She is one of the enrollment advisors for the online nursing programs.
Hello, everyone. We're hoping that you enjoy the time and we answer all your questions.
Awesome. Thank you, everyone. So now we will take it away, and Alex will go ahead and tell us a bit about Maryville.
Perfect. Thank you, Jane. So just to give a quick background about Maryville and who we are, as you can see on your screen, there are quite a few distinguishing factors about our program. We are ranked top for a private school by U.S. News and World Reports as well as Kippingler. We also have an Apple Distinguished School, which is something we're really excited about. We are ranked among the America's top colleges according to Forbes. Our school itself is accredited by the Higher Learning Commission, and our program is also accredited by the CCNE. We have numerous corporate partnerships, and we also are a military-friendly school along with a yellow ribbon school. So a little bit about our program. So this is just to give you a background. This is in regards to our Masters of Science in Nursing. There are 5 different concentrations, which I'm going to talk about in one moment. These programs can be completed in anywhere from 28 to 32 months. In regards to our MSN, it's a total anywhere of 41 up to 50 credit hours between 13 to 16 courses depending on the specific concentration. And then the clinical hours are listed on here. So for our acute program, it is 830 hours over 4 semesters. For our adult primary, it is 580 hours over 3 semesters. Our FNP program is a total of 745 hours over 4 semesters. A pediatric is also 850 hours over 3 semesters. And then finally, our psych program is 745 hours over 4 semesters. If you look to the right of the screen, you'll see the enrollment requirements. One of the major requirements is that you have a BSN degree from an accredited nursing program. So that's something we get a lot of questions on. It must be accredited. It's a minimum GPA requirement of a 3.0. You must have a licensure as an RN within the United States, 3 letters of recommendation, a CV or resume, at least 1 year of RN experience, and a 500-word essay. Within this essay, you will cover the topics explaining your interest in becoming a nurse practitioner, and also to explaining a little bit more about how you're hoping the degree is going to help improve your patient outcome in the future. Next, we're talking about the postmaster certification. So there are also 5 concentrations within this. The amount of length of time does again depend. It can be anywhere from 28 to 32 months. It's also to having the additional clinical hours in there as well. When it comes to the acute program, it's very similar to the hours that we're seeing in the MSN. They do match and pair very well, and they are very similar. In regards to the enrollment requirements, that's a typo. You need to have an MSN degree, not a BSN, so that is a requirement of the postmaster certification that you have an MSN. The GPA also requirement is a minimum of a 3.0. Same thing with the RN licensure within the United States. It has to be unencumbered and in good standing. 3 letters of recommendation, a CV or resume, also again at least 1 year of RN experience, and the similar essay as well too, where you're explaining and discussing your interest in becoming a nurse practitioner and how this degree is going to help improve your patient outcomes. So as you can see, here's the 5 different concentrations a little bit more in depth. They are explained. Both are offered in both the MSN as well as the Postmaster Certification Program. They're both offered on both of those levels. So you also have the Psych Mental Health Nurse Practitioner, Family Nurse Practitioner, Pediatric Primary Care Nurse Practitioner, Adult Acute Care Nurse Practitioner, and finally Adult Primary Nurse Practitioner. Tuition. So this is some areas that we get a lot of questions about when it comes to our program. The price per credit hour is $7.97 a credit hour. As you can see in your screen, there is the link that you're able to select, and that can give you more information in regards to the graduation, the graduate fees. In addition to the tuition fee, you also have additional fees outside of that. This includes your one fee. So the one fee is a lot of those smaller fees combined in a flat rate per semester. So this includes your graduation fees, clinical processing fees, type-on software fees. For more specifics, your enrollment advisor can review everything with you in depth with that. And then also you have a background check fee, which does depend on your state. So that's something that later on down the road you will be given, just depending on your specific state when that time comes for your background check. Clinical and acquiring preceptors. So one of the big things we emphasize here at Maryville is that you are responsible for acquiring your preceptors. It is recommended that the students have a possible preceptor in mind during the application process. And the clinical schedule and hours depend on the program. So as you can see from the previous page when I broke down the specific hours, that does explain how things vary program to program. So if you have specific questions in regards to your program of interest, please contact your enrollment advisor and they can review that more in depth with you. The online experience. When it comes to our courses and the schedule, depending on the program, you will have 8-week courses and also 16-week courses. So there is differences in between an MSN and a postmaster certification within the scheduling. For specifics, again, you want to speak to your enrollment advisor. The program is asynchronous, so what that means is there's never a set time when you're going to have to be physically logged in front of your classroom. Things can be done at your pace, but you will have deadlines and set days when things are due. The program is very much designed for the practicing nurse. So the deans are fantastic. They designed this program to be accommodating for you all to be able to work and have a life and do what you have to do as well as advance your career. The online learning environment and platform we utilize is Canvas. I know this is something that a lot of our students coming back have experienced already, but it is a great, very user-friendly platform. And faculty and peer interaction. So there are quite a bit of opportunities for interaction. There's different discussion boards, Facebook groups, and other things along those lines. And now what we're going to do is we have our fantastic faculty members with us, so we're going to hand it over to them.
Okay. So what would you like me to talk about first? You want me to talk about the transfer credits? Okay. So this is Professor Zimmerman. I am the director of the program. I teach in the program, and I'm also a part of the admissions committee, as well as Dr. Elby is the other professor that's on the call. And what we want to tell you about the transfer credits is that when you apply to Maryville as a master's in the master's program or the postmaster's program, if you have any credits that you've taken at other universities at the graduate level that you would like us to review, it is possible that I emphasize, that you will receive credit for those courses and you wouldn't have to repeat that coursework. Where it gets kind of tricky is there are courses that you may think fit, for example, the health promotion course that we have at Maryville. But what we do as admission faculty, and it's all faculty that review the admission files, is that we review your course description and possibly your syllabus to see if it matches our course objectives. So even though the course may be the same title, we have to ensure that you have met the course objectives in the course that you are asking for transfer. So we take this part of the admissions process very seriously, and there are times where we can't accept your coursework if it's within 5 years, or if you are a master's prepared nurse and you're coming back for a postmaster's cert, there are times where we can accept coursework, and there are times where we can't. So what I would encourage you to do is, if you have any coursework at a master's level that you want considered, you must submit that information when you apply to the program. Your admissions counselor will help you with that process. We will have to have your transcript and course descriptions from the university. Hope that explains that aspect of admissions. The gap analysis is something that happens when the postmaster students graduate with a postmaster certificate. So if you are a student that comes in as a master's prepared nurse, either in a non-clinical master's such as education or leadership, or you are already a nurse practitioner and you're coming back for a postmaster certificate in another concentration, when you apply for your board certification, either with the American Academy of Nurse Practitioners or the American Academy of American Credentialing Center, we have to do what we call a gap analysis letter, which means that we have to verify any coursework that we approve of when you enter the program as a transfer credit. We have to validate that you have met those course objectives to sit for the board exam. So again, this slide just refers back to the importance of your transfer credits, that we look at your transfer credits very carefully, and if we require you to repeat a course or repeat courses that you may not think that you need, it's because of two things. One is that they don't meet the courses that you've taken previously, may not meet our course objectives in the Maryville program, or more importantly, the coursework that you're submitting would not meet the criteria for you to sit for board certification. Hence, you will be required to take a Maryville course to fill those requirements. Course progression. So when you are admitted to Maryville University, you will receive an admission letter, and then you will be introduced to an online advisor, student advisor, and you will receive your course progression, which means that you will have basically a roadmap of which courses you will be enrolled in from the start of the program to the end of the program. So if you have questions about that or concerns about that, that is something that you talk to your online student advisor about. But you will have that information upon admissions to Maryville.
And with the course progression, this is Dr. Elby, It does also go in line. Many of the courses build up with each other. So that's why there is a specific course progression, is that many of the courses you're taking early on are prerequisites for the later courses, and you need that knowledge to really master and apply the material in future courses.
Excellent point, Dr. Elby. Thank you for that. Yeah, sometimes it's students may want to move courses around, but as Dr. Elby is saying, she's absolutely correct. There is an order by which we require you to take this program so that you complete your prerequisites and have the knowledge base or the clinical base to continue. There are times where we make exceptions to that, but that is something that you would have to talk to your online student advisor with and get approval. The online experience. So as you have heard from our other person on this call, I apologize, I can't remember her name. She was talking about the flexibility of the online experience. That is one aspect and wonderful thing about the online experience, but the other aspect is there is sometimes a perception of students who may not have been online students in the past that they won't receive the same experience or the same teaching or the same content as they would if they came to an on-campus program. And that is not true. We work very hard. First of all, we have the same exact content provided to you online as we do for our on-campus students. We only have the family nurse practitioner and adult gero nurse practitioner concentrations on campus, and we have all 5 concentrations online. And the online experience is very flexible, but it also presents the content in a very technology-savvy way. The content is presented in lecture format, very brief lectures that you review, videos, interactive case studies, media interactive pieces that you do to practice and learn concepts, group assignments, individual assignments, videos, live sessions. So the main thing that I think sets us apart at Maryville is that we have what we call Skype live sessions or online conferencing, where the faculty actually schedule live sessions with the students so that you have that in-classroom feel several times through the semester so that you can ask questions and have an interaction with the professor and possibly other students. So we have this program has been in place for several years, and I think that every year we get even better with our technology and how we present information. But we pride ourselves at Maryville of having the top of the line online experience for students, even if you haven't been an online student in the past. And the last thing I would want to say about that is we have a lot of help for our students that are new to the program. In other words, if you don't feel like you're a tech-savvy person, there's no need to worry about that. When you go through orientation, we step you through what a course looks like, which you can even get a sample of what a course looks like when you are applying to Maryville. We show you how the course is set up and how you can stay organized. We show you how to upload assignments or upload videos. We give you lots of information about the technology that you need to start the program. And there's a lot of tutorials and an online orientation that you complete before you actually start a class. So I think we not only do a great job in the classroom, but we also support you and have a lot of tutorial and information prior to starting a class to make you feel comfortable in this environment. Dr. Elby, would you like to add anything to that?
Yeah, and I know too, just like Jane had said earlier, we are very asynchronous. So if you're a nurse that works night shifts, there's recorded lectures for you. If you can't make the Skype live sessions, faculty record that so students can review that on their own time. Same thing, we allow 24 hours for students to take the exam. So if you work night shift, you can take the exam in the morning, at night. So it really does work with the working schedule because we know you guys, are required to be practicing and working as nurses. So we make it really as manageable as we can for you guys to excel in this program.
Thank you so much for the information, Professor Zimmerman and Dr. Elby and Alex. Now I'm going to address some of the questions that we had. Some students chatted in some questions, so let me go ahead and get started with those. So Alex, I think this is a good question for you. One of our students asked, do students still have to do over 800 clinical hours even though they are practicing as a nurse practitioner in acute care medical surgical hospital?
So that's a question we get a lot, and for that, it goes with what Professor Zimmerman was discussing in regards to the transfer credit process. So what happens is that will be determined when your admission packet has been completed, and then we can kind of assess and get a better idea of what courses specifically are needed. So at that time, that's something that you want to speak with your specific enrollment advisor about, and they can better address that.
Wonderful.
And just to add to that, go ahead, Mickey.
Yeah.
Just to add to that, it's possible that the person is also asking about clinical hours. If you are a nurse and you work, or a nurse practitioner, currently a nurse practitioner, and you're applying for a postmaster's cert, and you work, let's say you are an adult nurse practitioner and you are working in a critical care setting, and so you're coming back for your adult gero acute care nurse practitioner certification, you still have to do clinical hours. You can't work and be paid while you're doing your clinical hours. That's a conflict of interest. And you can't count hours that you've done in a work setting to count for your clinical hours in another setting. So we can certainly address that at admission, because there are nurse practitioners that come back for a postmaster's cert that may already have a crossover of the population that they serve. So we would customize your clinical experience in that regard, but the same amount of hours would have to be completed to complete a postmaster's cert. So I hope that answers the question as well, not just for didactic credit hours, but clinical hours.
Thank you so much for clarifying. And we do have another question for Professor Zimmerman or Dr. Elby. The student was asking, what is the passing rate on the licensing boards for students who have graduated from the psych program, psychiatric mental health nurse practitioner program at Maryville?
So our first cohort of the psych mental health nurse practitioner program are graduating in May. So we do not have any certification pass rate information. We won't have that until the following March. Usually March is the time every year where the certifying bodies send us the aggregate report of pass rates. So we won't have that until next spring.
Thank you for clarifying. I do have another question for Alex. So Alex, a student asked, is the program a cohort group?
So not in that traditional sense of a cohort where you're with the same individuals in every single class. You may get paired up again with same individuals, just depending on your state and different things along those lines. But it's not in that traditional sense where you're only in the same group with the same number of people.
Okay, thanks for clarifying that too, Alex. I have another question for Professor Zimmerman or Dr. Elby. The question is, do the clinical preceptors receive a stipend?
The clinical preceptors? No, at this time we do not. No, we don't pay our clinical preceptors to precept our students.
Yes. So students on the line, just for clarification, you'd be asking your preceptors to see if they can assist you. They're kind of giving back to the community, but they're not receiving a stipend. They're not receiving any monetary compensation for that. And then Alex, another question for you. Is there any way to take a full-time load to decrease the time frame of, this student was asking 28 months, but to decrease the time frame of the given program?
So no, the program's structured in a part-time manner, because if there was any additional courses added on, you really couldn't be able to work, and the program is designed specifically for the working nurse.
Awesome. And then, again, Professor Zimmerman or Dr. Elby, this is for you. What is the average class size for the mental health program?
This is Professor Zimmerman. That varies. Usually it's a regular didactic course or without a clinical is usually 15 students, no more than 16 or 17 students. For clinical, you are in a course section with 7 other students. The max number of students in a clinical section are 8 students.
Perfect, thank you. Another question for Alex. So this student is talking about how they're having a difficult time getting some of their transcripts because they've taken some classes many years ago. So they're asking if the courses are not relevant to their nursing education, their nursing classes, are they still required for the transcript?
Yes.
Sorry, for the
application. So, Mickey,
Go
were
ahead.
you going to at this time, we are requiring all transcripts to be reviewed, even if they are non-nursing transcripts. That may change, but at this time, we are requiring all transcripts to be received.
Yeah, and one thing I emphasize with my students is we need every post-secondary transcript. Even if it's one course, one place, one time, we need that transcript. It's just a policy. That's how it is to complete your application packet.
Yeah. It's part of our review for admission. That's very important.
Awesome. Thank you all for clarifying that. And then Professor Zimmerman and Dr. Elby, I have 2 questions from 2 different students, somewhat related. They're both about psychiatric mental health and clinical. So the first student was asking, are students allowed to complete clinical rotations in the outpatient setting for the Psych NP program? And then the second student asked, for the Psych NP program, do the preceptors have to be NPs or can they be PAs or physician preceptors?
So the criteria.
So this is Dr. Oh.
Go ahead, Mickey. I've talked about. Go ahead, Mickey.
No, you're fine. I will say for the second question about PAs or physicians or NPs, none of the specialties allow PAs at this point because the national organizations at this point are not recognizing PAs as preceptors for nurse practitioner students, but we do allow NPs and physicians. I will let Professor Zimmerman talk specifically about the psych mental health preceptors.
So the psych mental health preceptors can be physicians or nurse practitioners who are psychiatric mental health nurse practitioners. There are some psychotherapy hours required, and there are the psych mental health nurse practitioner coordinator, Dr. Brandy Stiles, reviews those preceptors because there are some specific requirements that I don't want to speak to, but there are some psychotherapy hours where there are some alternate counselor types of health professions that can do some of those hours, but it is spelled out in your clinical packet, and those individuals are reviewed by Dr. Stiles for approval.
Perfect, thank you. I have 2 questions for Alex that are somewhat related from 2 different students. So one student was asking, well, for the psych program, but for all of our programs basically, are students required to find their own preceptors for their clinical rotation? And then followed by another student's question, are students required to use the same preceptor for each class that mandates the clinical hours?
So yes, you are responsible for finding your own preceptors. That is absolutely an expectation. We say from day one that it is your responsibility. You are ultimately responsible. And in regards to using the same preceptor, from my understanding, that is your call and what you prefer to do, as long as the preceptor meets the specific requirements that are needed for the program. If you want to stay with them, then you can. If you don't, then you don't have to as well.
I think there is some limitation in the adult gero acute care program that I think you can only be with the same preceptor for 250 hours, whereas the adult gero primary care, you could be with the same preceptor, and there are some variable hours in family that Dr. Elby could speak to. So again, that's exactly what she said, and that is if you're able to meet the clinical requirements, then you can stay with the same preceptor for multiple semesters.
Wonderful.
And
Thank
I
you for
do
the
know Dr. Albee. I was going to say for our FNP and adult Gero NP, we have decided that we would allow students to use the same preceptor through the program. We just do caution students to ensure that they're really getting a thorough, well-rounded experience, and that preceptor is really teaching them everything they need to know, because sometimes one experience you may not see things that you would see in other settings. But I know for FNP and adult Gero primary care, we did come to that conclusion.
Awesome. Thank you so much. And then for Professor Zimmerman, for someone who has been out of academia for a while, does Maryville University provide assistance for things like writing papers and doing citations?
There are some there's some assistance actually built in the orientation about citation writing and writing in general. And the first couple of courses, there is a lot of assistance within the course about writing and specifically the APA format. And we have some online programs that we use. So I would say overall we do have support within the courses, and we also have some online resources that we refer to students, as well as some assignments that will help you learn the mastery of especially of citation writing.
Wonderful. And then Dr. Albee, you mentioned this before, but a student wanted clarification. How often do students have live dialogue with instructors?
So it depends on the course. Some courses do have it more often during the semester, but at minimum 3 times a semester, faculty will have live sessions with students. Like I said, it's not mandatory that students attend, but because it is recorded for students who are unable to attend, but it is a good way for students to get that interaction, not only with their faculty, but with their peers.
Perfect. And then Alex, maybe a student joined on a little bit later, but can you cover again, do students ever need to come to campus? Can online students attend graduation, the commencement ceremony?
Yeah, so that's a question we get a lot. No, you're not required to attend campus unless you want to come. It's not like you're barred for coming, but you're more than welcome to attend. And yes, you are able to attend in the graduation ceremony as well and partake in that, because that's something that's important. You've worked really hard to get your degree, and we want to celebrate with you.
Definitely, I agree with that as well. And then Professor Zimmerman, how intense is the workload? As a working nurse professional, how much time does a student need to be able to dedicate to his or her studies per day, per week?
The course is not outlined about how many hours you would want to put in or need to put in per day, per week, but I would say per week for 1 or 2 courses, it would take several hours to review the course material online, and then depending on your study habits and how you learn and how much time you need to review some information or learn new content would be variable. But I do believe in the courses themselves it outlines that there are maybe 6 to 8 hours of work a week minimum. But remember, you are not in the classroom. So our current graduate students come into class 2.5 hours for 1 class a week. So you have to factor in that you are not coming to class. So it will take you some time to do the readings and review the course content online in addition to your studying or your preparation or completing assignments.
Thank you. And then Dr. Albee, and perhaps you can answer this one, are all of the exams live proctored, such as FaceTime? So perhaps you can talk about how we handle exams and how students are proctored for exams.
Yes, so each of the exams is proctored. Right now we are using a program called Proctorio. So it's a web-based program that students log into while they're taking the exam that will monitor the students. So yes, each exam is proctored.
Perfect, thank you. And then Professor Zimmerman, we have another question from a student. Is there a lot of required group work throughout the Psych MP program? But perhaps you can speak about our various programs.
I'm sorry, can you repeat the question?
Yes, of course. The student was asking about group work and if there's a lot of required group work throughout the Psych MP program.
The group work varies from course to course. It's certainly not every week, but there are some courses where you may have one or two group assignments where you will be working with other students online. It just varies. But there is some group work, but it's not every week.
Wonderful. Thank you. And then, Dr. Elby, do you have any tips or best practices on time management?
So with time management, it is a master's program. So I always tell students, remember that, it is a higher educational program that you're doing. So it is going to take some time out of your life. So really kind of getting a schedule and scheduling specific times during that week, maybe the days that you're off, that you can make time to study. And do know that, like Professor Zimmerman said, it's on average 6 to 8 hours a week of studying that you're going to do. So, taking breaks in there, breaking the scheduling up to study. But if you schedule that time within your week, it will make it much easier than, life gets busy and all of a sudden you're like, I haven't studied for this test coming up or for this information I need to know. So really having a well-organized schedule is the best way to prepare yourself.
Definitely, and we tell our students the same thing, to be organized and stay on top of deadlines. And then Professor Zimmerman, another question for you. If a student had to take a leave of absence for one semester, would they be able to pick up where they left off the following semester, or are some of the classes only offered on certain semesters?
That's a great question. All of our online courses are offered every semester. So if you had to step out for up to 3 semesters, you would be still considered a active student. After 3 semesters or after 1 calendar year, you would have to do a revised admissions process. But yes, you may stop out for a semester and then pick up the next courses that you have to take in your course progression the following semester without a problem.
Perfect, and I do think that's one of the highlights of our programs, that students don't have to wait a full year to pick up where they left off. They can just get back started the very next semester. Alex, I have another question for you. How tech-savvy do I need to be successful in your online program?
Great. So that's a question we get a lot of with students coming back or students that have never taken online courses before. So we don't require that, you know how to build things from scratch or anything along those lines. But we do want you to have some basic knowledge of being able to navigate through websites, being able to utilize different softwares like Microsoft Word or PowerPoint, things along those lines. So it's not necessary that you are the top tech person, but also, too, we want you to have some type of basic knowledge and basic usage.
Perfect. And then, Alex, there's a few questions about the application process. But does a student have to be working full-time to get accepted into the program? And then also, about how long does the application process take?
Sure. So, no, it's not a requirement that you're working full-time, but it is a requirement that you have some form of direct patient contact. That is something that is very, very important, that you have to have that access to direct patient care and contact. In addition to that, when it comes to the application process, I have students, if they're really, really good, it can take about a week and a half for them to finish their application packet. Typically, the things that can kind of hold some people up are the transcripts. If they come by mail, that can take a little bit of time. But overall, it's a fairly seamless and fairly easy application process.
Perfect. Thanks again. And students on the line, if you have any additional questions, feel free to ask them in our chat box. But otherwise, it seems like we've gone through most of the questions or all the questions that students have asked. So at this time, I'd like to thank Professor Zimmerman, Dr. Elvey, and Alex for the responses and for this informational webinar. And thank you to all the students who submitted a question as well. Unless we get any other questions, I'm going to go ahead and say that this will close the Q&A portion of our webinar. If anyone has any more questions that they think of later, please do not hesitate to reach out to us. If you have an enrollment advisor, make sure you contact your enrollment advisor. And if not, you can use the link that you see here, this live.theceta.com/site/Maryville.onlinenursing. You can use that link to schedule an appointment, and one of the enrollment advisors, one of us, will definitely follow up with you. And before I conclude, actually, we did get a few other questions. So, Alex, can you kind of reiterate about how long does the admissions review take generally?
Sure. So once you've completed your admissions packet, that gets sent over to our faculty, and they review your packet. That can be anywhere from 3 to 4 weeks.
Perfect. And then to follow up with that, Alex, if a student has already been accepted into the program, when should they expect to receive a class schedule, or who would he or she contact?
Sure. So that individual that you're going to speak with is your student support advisor. They're the ones that build your schedule out for you, and that will be done either the week prior to classes or the first week of class where they send it out specifically to you where it's personalized to your schedule.
Thanks again, Alex. So thank you, everyone, for taking the time out of your day to join us. Thank you so much again to our presenters, Professor Zimmerman, Dr. Elvey, and Alex. For the students, we hope that you found this webinar useful. I believe this webinar is going to be, it's being recorded, so it should be available to you shortly. I think some students, they didn't catch the audio in the beginning, but you should have access to that shortly. And we look forward to speaking with you soon so that you can put in your application and get started with your MSN or Postmaster Certificate program. And we all hope that you have a great evening, and thanks again for your time.
Thank you.
Thank you.
Thank you.